thanks. More hospitals are rethinking their policies around childbirth once a woman has had a C-section. Topeka Stormont Vail is among the latest, now saying for most women, once a C-section doesn't mean to always be a C-section. 13's Melissa Bruner explains in tonight's To Your Health.
For years, many hospitals shied away from allowing women who previously had a child by cesarean section from welcoming their next child by vaginal birth. The top worry was risk of uterine rupture.
A uterine rupture is when the scar on the uterus, where it was previously entered for the C-section, bursts open from the strength of contractions during labor. When that scar breaks open, baby is losing oxygen and mom is losing blood, and so we have minutes to intervene with an emergency C-sections. And although the absolute risk is low, I think there was a low tolerance for that.
How low? Stormont Vail Lincoln Center OBGYN Dr. Jessica Kiefer says about 0.5% for spontaneous labor, 1 to 2% when induced. By the early 2000s, many hospitals decided to ban what's called VBAC, vaginal birth after cesarean, unless a woman declined surgery. But more recently, continued research has hospitals like Stormont reevaluating.
That they should have choices in labor, and if they have goals that we can meet, we should try to do that.
This month, Stormont updated its policies to offer VBAC to most moms. Dr. Kiefer said conversations about options and risks will begin at the first prenatal visit. In addition, they have 24/7 OBGYN and anesthesia coverage at the hospital to respond in minutes should a complication arise.
As someone else who's previously had a C-section, I think it's a great opportunity for women in our community. We know that women who want to have large families have a lot of complications and increased risk of complications when they've had 2, 3, 4, and 6 C-sections. And so the time to intervene is after that first one to decrease their overall risk in pregnancies in the future.
Melissa Bruner, 13 News.
Both University of Kansas Health System St. Francis campus in Topeka and Via Christi in Manhattan say they'd had a long-standing policies of discussing the VBAC options with patients. David?